preventing and treating diabetes. Now, prevent diabetes, think about that as equal to pre-diabetes equals prevent diabetes. That's not mine. I got that from the ADA, but I really like that. Like if you change your mindset to think that when someone is in the stage of pre-diabetes, this is an opportunity for us to prevent diabetes, okay? Not I'm borderline diabetes, helping people to change their language and their mindset. This is an opportunity for us to prevent diabetes. And how do you do this? Lifestyle modifications. Now, I do want to quickly go over what effective lifestyle modifications are, because me being a clinician that has been a part of a busy practice, being busy, we're busy, okay? And you don't always feel like you have the time to educate people over everything and to also keep yourself up to date on everything that's going on and all the new updates. Well, the reason why we push lifestyle modifications is because lifestyle change brings on behavior change. And that is what is sustainable. Think about it. When you're trying to do something and change something, if you're just doing tasks, you'll do it until you're tired of it. But when it's a part of your lifestyle, it's a part of you now, okay? And so ways to go about doing that is we try to empower our patients through goal setting, positive reinforcement to when they see that they've gotten on the scale and they've lost that 2 pounds in 7 days, that is a positive reinforcement. And some of the things that I often suggest to people is really going in and doing medical nutrition therapy with a registered dietitian. This is your best friend. And many registered dietitians offer services virtually. MNT by itself is just as effective as metformin. As you see here, it can reduce the A1C for type 2 up to 2%. Metformin does that by 1 to 2%. And MNT does that by itself. Just people being more knowledgeable about how to eat, they can definitely lower their A1C. Weight management with prediabetes, it's recommended that you decrease your body weight by 7 to 10%. And if you already are diagnosed with diabetes type 2, by 5%. That's not a lot of weight. It's really not a lot of weight if you do the math. And physical activity, when we're telling our patients, you need to exercise more and eat better, our patients don't know what that is. So we really have to outline that for them, lay it out for them. For all of us, not just people who have diabetes, it is recommended that we all get 150 minutes a week of moderate activity. Really, that shakes out to be 30 minutes, 5 days, okay? Resistant exercise 2 to 3 times a week on 9 consecutive days. For the elderly, they suggest flexibility and balancing exercises. So this would be your Tai Chi or yoga. One thing that I love about the elderly is that once they become a part of the retired population, Medicare provides what they used to call silver sneakers. Some people call it something different, but they pay for them to go to an exercise facility. And they have classes specifically for the elderly. And for children, 60 minutes of moderate to vigorous exercise a day for children. And they also have added here recently that they do more strength and bone strengthening because we in America, we typically run low in vitamin D and calcium. So what are some resources that you can help with those who are at risk for diabetes? Well, I want to introduce to you the Diabetes Prevention Program. And this program is so effective that it can reduce someone's risk for type 2 diabetes by 58%. And if a person is over 60 years of age, it can reduce it up to 71%. That is phenomenal, phenomenal. Okay. And this program was put together and built off of one of our landmark trials that guides all of diabetes management, which is diabetes prevention program research, where they show that just modest behavioral changes, such as losing 5 to 7% of a person's body weight, reduce their risk of type 2 diabetes. And so I really want to really bring home how important this time in the pre-diabetes stage that we have. We know that the quality of life decreases with diabetes. We know how expensive diabetes can be and how it not only costs the person a lot of money, but it costs our healthcare system tons of money. We can stop it there in the tracks. And this program runs over about a year. It can go a little bit longer than that, actually, but there's so many sessions within the first 6 months, so many sessions in the last 6 months, and there's two entities that certify and are recognized that is through CDC and Medicare. The eligibility criteria is slightly different. I see more people recognized through CDC, but either one of those you can have and develop your own program for your own practice.